The next is the neck. It has three necks. Number one is the anatomical neck that provide attachment for the scapular ligaments. It has anatomical neck that provide attachment for the scapular ligaments. So whenever you think of the anatomical neck, you should think of an anatomical function. So the anatomical neck has an anatomical function, which is to provide attachment for the scapular ligament. The next thing is the surgical neck. The surgical neck is seen between the greater and the lesser tubercle, and it is weaker than other proximal parts of the humerus. It is weaker than other proximal end of the humerus, thus it is prone to fracture. It is prone to fracture. Since it is prone to fracture, it means that when there is fracture to the humerus, there's possibility of doing surgery to correct this fracture. So when you think of surgical neck, think of the point that is prone to fracture, and when there is fracture, there's possibility of surgery to correct that fracture. It will help you to remember the surgical neck. Next is the morphological neck. The morphological neck is found between the epiphysis and the diaphysis. It is regarded as a true junction between the head and the shaft of the humerus. So when you think of the morphological neck, you are think of transition from the upper end of the humerus to the lower end of the humerus. So when you think of anatomical neck, you are thinking of anatomical function. When you think of surgical neck, you are thinking of surgical implication, because when there is fracture to the humerus, there is a surgical implication there. When you think of morphological neck, you are thinking of the change with a transition from the upper end of the humerus to the shaft of the humerus. With this, you can remember something when you are asked about this neck of the humerus.